Good morning. I can skip the introductions, which is great. So I'll facilitate or moderate the first debate, evidence-based policymaking regulation of psychoactive substances. Well, it's evidence-based, as is suggested here. And the Psychomodulation Act was the first step in that direction. Perhaps I'll hand over the floor to Madam Němečková to share with us. Good morning, I suppose still. Distinguished ladies and gentlemen, well, I would like to say how happy I am that after the third reading, we have adopted the Act on Psychomodulating Substances. Thank God. I shall briefly sum up what it is all about. Nowadays, when psychomodulating or modulatory substances are available in the market, but there is no regulation, meaning children can get access thereto without any problem, because it's also sold as a collectible. It's in candies or in the form of candy, sweets. Therefore, we had to decide prohibit or introduce smart regulation. And since we have pretty many adult users, we concluded that a prohibition is not a way. It wouldn't help us. It would only boost the gray market or black market, which is why we decided to go for a strict regulation. Well, these substances shall not be accessible to children up to the age of 18. It will be sold in specialized stores. Those stores or outlets will have to be registered. If they want to also sell through e-shops, so only under the proviso that they also have brick-and-mortar stores. One of the important things that we shall apply to other substances, not only psychomodulatory, there is a double verification of age or check of age. In other words, the person has to prove he's 18 years plus, both when shopping and when receiving the goods on delivery simply. So this CAFIA, which is the Czech simply inspection body of agriculture and food, very strict or severe sanctions will be imposed in case of non-compliance. Once it has been passed in the Chamber of Deputies, it was notified to European Commission. Let us keep our fingers crossed and hope that EC shall approve it as it is, or as it was presented or submitted. I believe it is well elaborated, and we have really thoroughly into the minutest details went. Hours and long hours have been spent on that, both by officials from ministries, experts, simply all the stakeholders. So the bill simply the bill or draft is truly of quality. Hopefully it'll be passed in the Senate. There shouldn't be any obstructions, we assume. Well, that much by way of introduction on my part, and whatever questions you might have, or if you require an explanation, don't hesitate. Now, Mr. Pavlovich, Deputy Minister, as far as we are concerned, we know this is not a one-off thing or experience. This is going to be a long-lasting issue. It's not like somebody complies. Okay, non-compliant go to prison behind bars, but the essential thing that the societal danger simply is not that big to sentence people to incarceration or imprisonment. These are substances which are not to be given to children, but it does not trigger such a severe hazard that these users would be eligible for imprisonment. Well, the substances will be taxed and PS will be taxed, and we also have to bear in mind the necessity of prevention and addictology. So it's not only about, we are not going to sell it to children, but we have to admit that many substances available in the society, like, alcoholic drinks, many substances which are prescribed, are not fully, so to say, harmless. And therefore, we have to, all the money we get from the taxes, or many of the revenues, we should spend on prevention or assistance. It is a necessary part, or it is enshrined in the law. So it's not merely a piece of paper which would, let us say, introduce the third layer of substances. No, it aims at our ability as a society to work with it, and we should not simply let part of the society die because they will make themselves some cannabis or simply hemp cream and use it, or soup, or whatever. It's to be further discussed. Mr. Peksa, member of European Parliament, thank you for the floor and for the opportunity to speak. I think I shall share with you the European perspective. You well know that next week we have elections to EP, and then the Commission will be formed. And that's exactly the time when long-term visions are formulated and plans for the future are adopted. So, you may know that all these addiction policies are extremely fragmented. There are several commissioners responsible for that. Hazard is not even dealt with at the level of the Commission. So what do we need? First of all, we need unification. One single entity or person should be responsible for all these policies. And also, the Commission should start really working or applying the harm reduction principle. So the substances should be regulated in dependence on their safety or dangerousness, rather, or hazard. We need an act that will correct the European regulatory framework, which is really obsolete. That means extremely hazardous and fully safe, and nothing in between. There's a gap between those two extreme categories, so that should be changed in the future. It's a challenge. The European Union and member states, have to comply with conventions, treaties, which is the single convention on narcotic drugs, on psychotropic substances, and we will have to co-define the European framework according to our wish and desire. And the other issue, which is Schengen agreement or Schengen treaty, which, though being excellent, since we may freely travel throughout Europe, but in reality it prevents certain substances movement throughout Europe. So, therefore, harm reduction cannot really be put to life. According to official reports issued by the Parliament EP, which 1/3 of Europeans suffer from mental health disorders of a certain type. So we should do our utmost to offer new solutions or responses. We should implement or conduct research appropriate and contributing to the addressing of this general crisis. More money should therefore be allocated to mental health related research and the potential use of psychedelics to this purpose. And we should do away with the administrative barriers or obstacles which are the stumbling block. I believe that the first excellent step was the following. There is a group of MEPs who strive for medical use of psychedelics option. Hopefully we shall succeed. Our party, Party of Pirates, we have a agenda program in which this sort of topic is described in details, and it covers all the landscapes, in other words, the situation in the Netherlands, Germany, etc. And before we open the discussion, I'll hand over the floor to Mr. Mravčík. Well, I thought it might be useful to throw some light on psychomodulatory substances or PS actor. If you want what that is, why don't you Google it out? Psychomodulating or psychomodulatory substances, which is something we have introduced to the world since we felt the need to define in terminology a category of products that will be allowed to be marketed or placed on the market with respect to their psychoactivity. And so this is a concept, legislative concept. These are psychoactive substances which are not controlled globally, and we try to invent and set up in this country or design regulatory framework, and we felt the need to somehow call this category. We have psychotropic, psychoactive, psycho whatever, just name it, addictive or dependency producing. And psychomodulatory was still kind of unoccupied term. So it'll become a buzzword, which is why it's on Wikipedia. We publish numerous papers or articles which describe the process of what made us actually design this regulatory framework and all the principles relevant thereto, and also how simply the society is to approach psychomodulatory substances, to regulate it based on the hazard they pose or risk they pose to the society, to children, responsible marketing, information, thorough information describing the product, piece of advice about safe dose, health warnings, and so on and so forth. And this framework that we have, so to say, developed for substances that are not intentionally controlled and might be under this regulation, well, there we opted for stringent parameters or requirements. The regulation, our aim was to adopt a regulation that would work. That means to bring these substances to the legal market from the illegal one, what we call in addictology, or addictology breaks, so simply measures, preventive measures, which are not that much stressed by the existing regulation. Well, that much to explain the concept or term psychomodulating or modulatory substances and PS Act. This initiative offers, so to say, a space within which we can contemplate, or think about the ways to regulate substances, or whether perhaps we should consider regulating like alcohol, tobacco, nicotine, or other prohibited illegal drugs like psychedelics, where psychedelics still belong. Simply, this is very useful and helpful because it shall give us, or it will become a new platform within which we can work with it and try to put it or place it into a meaningful framework of regulation. This is it. So far, anyway. Thank you. I will give the floor to Madam Němečková. So, act on PS. After 70 years of, so to say, binary system, that means alcohol, tobacco, those are okay, while the rest is bad, and imprisonment or therapy ban, simply prohibitive regime or prohibitive model. Where is the limit? Or let's take an adult. And at what point of time the regulator can step in and not to violate the right to freedom or what? We now know that many users actually use all the different substances for as a treatment or self-healing. Well, medical point of view, that's one perspective, so to say. From that point of view, it becomes so dangerous to the individual that when taking it, it will simply hurt or harm him, and subsequently will burden the healthcare system immensely. Which means that it'll have an impact on the entire society, and then the societal danger which it poses, because that person may be dangerous, may jeopardize the surroundings or people within his vicinity, or perhaps, certainly not be a role model. So, danger to an individual, danger to the society as a whole. And once the stuff or the substance is that dangerous, it is only proper to prohibit it for adults or regulate it simply. Not everyone behaves in a responsible manner and can simply assess the potential danger or hazard of taking the respective substance. When we take the example of alcohol, which is widely debated, when you see the consequences, health consequences, social consequences, or societal as well, the costs incurred, well, it all makes you wonder. So there were already considerations or questions raised whether or not to ban alcohol We have many examples going back to the history of prohibitions, and we realize that prohibition is not the right option, because then the black market will always be there. Some substances we should continue tolerating, even though there is a certain degree of danger in their consumption. But I am convinced that the most important thing is to protect children who cannot imagine the consequences. In fact, this is an extremely interesting question, and it's not trivial at all. And it will take time. It's a process. The criteria based on which we shall assess the substances, and we shall schedule them, including the psychomodulatory substances schedules, and the substances that will be allowed to place on the market. Well, that's essential, because don't forget that we have to first overcome the old paradigm and introduce a new one. So, psychoactive nature is not a reason for prohibition. If a substance was slightly psychoactive and it might get established in the market while it was scheduled or put on those schedules which of substances prohibited. Naturally, there are people, vulnerable people, or vulnerable due to their age, but majority of adults are self-disciplined or manage to control the use of psychoactive substances. It all now depends on the way to measure the risk or danger of this or that substance, and set a limit up to which it is acceptable. And then we also need a normal set a measure or limit, and then once exceeded, more stringent measures will be applied. That's a challenge, since alcohol became, unfortunately, accepted or tolerated by the society, even though the addictive potential is huge. Then hepatotoxic, neurotoxic, carcinogenous, teratogenicity is there as well. Well, we should not allow, as a matter of fact, substances to be placed on the market in which such high risks are inherent. With high consumption, it may trigger tumors, etc., etc. And yet we have alcohol and tobacco products freely available on the market. So we have to think twice, and perhaps this is gonna usher in new ways of assessing the safety or dangerousness of a substance.
I'm not a doctor, an expert on medical ethics, but from the perspective of civil rights, the problem is that these substances may modulate behavior to the extent that the person would be a danger for others. So, for instance, a person who is under the influence of alcohol and drives a car can endanger others. But if you endanger only yourself, then the person should just be well informed, but then it's his or her decision, but doesn't harm others. So you should be informed about the substance, what the side effects are, what, for instance, regular use would mean, whether There may be some addiction, or it may just change your perception, etc. And you may, to for instance, great extent have substances that naturally are harmful, such as sulfuric acid. So if you would inject sulfuric acid in your vein, yes, you would die, but otherwise it's not banned. So why ban substances altogether? But you can have controlled use. And I'm saying one thing, well, yes, people should be informed, just like we tell people you shouldn't stick your fingers in a socket because you may be killed by electric current, and the same goes to you. And certain things shouldn't be sold to children, so certain substances should not be sold to children. Well, I believe that we should not adore, worship the use of addictive substances, such as, for instance, we are world masters when it comes to the number of beers drunk per capita. We should also think about that. And then there was a time when doctors even were, well, it's a long time ago, they were recommending smoking, but you can still find some of these ads from times long gone. So certainly nobody believes anymore that smoking is a healthy habit in life. Just like nobody hopefully believes that alcohol consumption is a healthy activity that you should indulge in every day. But then it's always a question of how much of it you consume per day, and that's also the same with the substances, how we should approach those substances. So it's potential poison if you take too much of it, but may help if it's only a small amount that you use. And as has been said, we must be aware of the risks. So there are substances where it's hard to overdose, but other substances where it's very easy to overdose. And then, for instance, there would be articles published like if you would take this or that number of pills of a certain drug, this would lead to death, etc. So, for instance, this amount should not be readily available, etc., protecting users from the implications of his or her own decisions. So that the user would not be, so that it wouldn't be that easy to overdose yourself. So, for instance, these nicotine pouches and overdosing yourself with those. And then the size of the packaging should be crucial. So it's not like you permit a substance to say it's perfectly okay, you're 18, you are free to buy whatever you wish. So whatever content, purity, and size of packaging. But you should really inform the user well. For instance, like inform the user, this would help you if you have a mental health problem, but it's not always a panacea. It is therapy. Part of the therapy, it helps you contribute to achieving low recurrence of your problems. But it's not that ketamine will readily solve all your problems in mental health, but nobody's saying that. So it's something that could help, just like a cholesterol drug gives you sufficient time to change your lifestyle. It won't solve your problems if you take the pill. No, your problem is not something that goes away. And the same applies to the psychomodulating substances. Thank you very much. And that brings me to my next question. My first goes to Associate Professor Mravčík, and also from the perspective of a regulator, the substances that we are speaking about, ketamine, psilocybin, MDMA, these have low addiction potential compared to substances that are legal these days, and people tend to turn to them as a form of assistance. However, with only a few exceptions, there is no safe settings available, and hopefully together we are looking for ways of how to gradually introduce these substances in therapeutic practice so that we can have this controlled and safe environment in which we can help the patients regain balance. How is the safe use? And Viktor, I'm asking you as an epidemiologist. So how can we help people find this safe environment, and will this then have an impact on the people who also use these substances in the unsafe environment? Do you think that it will have an impact on the number of high-risk cases or something? So how do we protect those who use these substances in the unsafe environment? Well, I'm now trying to translate your question so that I understand it, because I didn't. And so you're asking whether we can somehow control or moderate the use of these substances. Well, this is what's part of harm reduction interventions and strategies. So how do you use a substance in a safer manner? And that applies to the whole usage patterns, whether it's dosage, modes of use, the setting and set. This is very important in psychedelics. Harm reduction has already been mentioned before as a principle that leads to reducing the risks for one's health and for society at large. So this is a principle that should be followed, something that works. And the principle can be applied in multiple ways through multiple tools. Some of the medical interventions, such as, for instance, some substitute therapies using all sorts of substances, for instance, the agonists, opioid agonists, and other substitution pharmacology-assisted treatments. So that's one thing. Another thing, and this is broadly discussed in the context of the crisis in North America, is a safer context of the supply. So how people can obtain those substances with a safer pharmacological profile in a safer context with the necessary information that would help them retain or obtain control over the use of those substances. And there was an interesting idea or question whether we could bring those principles over to a more commercial offer. The therapeutic context, that's clear and strong. So yes, we have a strong framework for the provision of these healthcare services, for introducing these substances on the market, for prescribing them, etc. in these diagnoses. But then when it's beyond that therapeutic context, we are on thin ice, and there is not that much experience there, and we feel that regulation can't really be that strong, that there are fewer options that we have out there. But this is our task in the new regulatory framework, to start to actually seek ways of safeguarding safer supply, so that the harm on individual and society-wide level is as minimal as possible. So much from my side. I don't want to speak for longer. And now let me ask the legislators, so both the MEP and Madam Deputy, whether when we speak about psilocybin and other substances for therapeutic use, do you think that the door is open to have that enshrined in legislation? Is society ready to start helping patients with these substances? I must admit that I wouldn't mix these two things together. I believe that we need to distinguish those things. From my perspective, so what we have substances that our efficient experts believe that these can help. As you've mentioned, the psilocybin, for instance, we know that in severe depressions, the patients are resistant to the traditional pharmacotherapy. And now that we know that there is a substance with which you could work and that helps the patients, perhaps not all of them, but even if it was just a single patient whom it would help, I believe it's our task to enable the substance enter the therapeutical process. However, I do not think that this is related to the psychomodulating substances for use by the general public. So I would really distinguish these two cases. But sometimes it is presented as follows, that, well, this is hazardous. If we would introduce it, that it would be abused, but then everything can be abused, really. A lot of patients overuse anxiolytics and similar drugs, and this is not discussed sufficiently, so anything can be abused, really. And even if there was just a single patient whom it would help and it would be evidence-based, I believe that we shouldn't hinder that, but rather facilitate it. I understand how the Czech Psychomodulating Act is worded, but that's not the only way. Taking some substances that hadn't been defined, but then there would be this weak regulation compared to the banned substances. But if you look at the banned substances or strongly restricted substances, and there are smaller restrictions applicable to those. So I, in principle, would not be against regulatory effort. We know that psilocybin is a substance that helps, even though the scope of trials available is not sufficient. We are only confirming the research results. So let's do the research that truly confirms that it does help. And we should then define under what conditions it can be brought on the market, and let's treat it as a drug. I don't have a problem with that approach at all. Well, yes, what comes to my mind is one thing. It's very hard to mix this commercial model in which the substance would be introduced on the market for recreational use with this therapeutic or medical framework for the use. But then, even now, there is a gray zone in which this reality already exists. And, well, we would perhaps through these changes be able to better understand it and operate with it. In the Czech Republic, many people have an issue with pervitin, methamphetamine, some 30,000 regular users. That's the assumption of methamphetamine in the Czech Republic, and there is no substitution therapy alternative for those. So then there should be the concept of safer supply, as has been mentioned, for probably everybody involved. It would be better if they could have access to the substance in a therapeutic context or public health context. that would be safer. And if you take a look at what has happened to opioids and opiates, there was the heroin epidemic of the 80s, then substitution therapy was introduced, the respective preparations that also are used legally in the non-medical use. So the opioids are misused on the addiction market. So from the official pharma context, it has actually got away, but then this drug has a higher safety and pharmacology profile compared to heroin. So this has some positive implications. Of that. So yeah, that would be the gray zone where we can perhaps start operating with it in more formalized manner for the benefit of our society. Well, yes, definitely. These two uses shouldn't be mixed up, so doctors can use with different concentrations, different routes of administration for therapeutic purposes. So these are really two distinct areas, recreational use and therapeutic use, and we shouldn't be mixing those two up. So therapeutic use, recreational use should remain separate, and then that would naturally have an impact on the concentrations in which those would be available. But then the doctor perhaps would need a higher concentration than the one that would be available in the market. The doctor should have that substance, but that should be in controlled environment, and the doctor is then the guarantor of making sure that these substances don't leak from the system. That would have criminal implications should that happen. And yes, so definitely these two are completely different areas, but doctors should have those substances available in higher concentrations to achieve the effects that they need to achieve, and really therapeutic use and recreational use, completely different domains. Thank you. Thanks to the new regulation, substances will make their way onto the market with a higher safety profile compared to other substances that are available on the illegal market. People are not stupid, really. Well, yeah, people have the tendency to protect their health, for sure, and then seek effects and for a reasonable price. And if there are safer substances on the market, perhaps the rate of use of the higher risk ones will be on the decline, because then there'll be those safer substitutes. The best dopamine is the one that you obtain naturally, so for instance through sports, so that it's not just swallowing pills and being happy. And then the doctor, because he or she has various interventions available, the doctor can also advise the patient, like, your lifestyle is not ideal, let's change your lifestyle so that you don't need these substances. And like, you shouldn't be harming your health because of your lifestyle matters. Okay, thank you very much. Anything else that you'd like to add? So, anybody? Well, it would be great if the doctor's word could do all the magic. Okay, well, thank you very much. Thanks to all the panelists. So now the time has come for lunch. Thank you. That was the first panel. Ladies and gentlemen, that was the first debate. So we had Zdenka Němečková, Mikuláš Peks, Viktor Mravčík, Josef Pavlovic, and the host of this first panel, Mr. Tomáš Sadílek. Thanks to all of you.